All right, before we begin, are there any questions? I'm going to assume not because I'm not hearing anything. Can somebody confirm you can hear me?
Yep, I can hear you.
Great, thank you. Let me share my screen here. Should probably get that there and out of there too. Close that down. Come back to that. Let me share my screen now. All right, you should be seeing my screen now. Today is February 8th, and we're going to be discussing Lab 6, disc diffusion and antibiotics. Any question about any of that? I think I can close this down. Lab 6, disc diffusion, evaluation of disinfectants and antiseptics, and antibiotic effectiveness. There is some reading to do before the lab, so make sure you do the reading. We'll have some video clips in today's lab and a virtual lab as well. The learning objectives for this lab is 1, be able to identify the type of chemical agent and the active ingredient used in various disinfectants and or antiseptics. 2, evaluate the effectiveness of disinfectants and or antiseptics using the disc diffusion method. And when I say the disc diffusion method, I mean the Kirby-Bauer method. These two terms mean the same thing. One is it's obviously using a disc to measure something, and the other is named after the scientist who invented the procedure. 3, determine the mode of action of various antibiotics. 4, evaluate the effectiveness of various antibiotics using the disc diffusion method. 5, list variables that influence the antibiotic disc diffusion susceptibility testing. And 6, be able to define the terms sterilization, disinfection, disinfectant, antiseptic, bactericidal agent, a bacteriostatic agent, an antibiotic, spread plate, and zone of inhibition. This lab will mainly be looking at Objective 4, evaluating the effectiveness of various antibiotics using the disc diffusion method. However, we will touch on all of these topics. Number 5, probably the second most important one. All right, evaluation of disinfectants and antiseptics. Sterilization is a term that means the elimination of all viable organisms, including endospores. If you were to come into the lab, we would give you sterile media, and most of the things that would be sterilized would be items that have been placed in the autoclave, and that can sterilize like media or test tubes and remove endospores as well. Disinfection refers to the destruction of vegetative cells, not necessarily to endospores. A disinfectant is a chemical agent applied to an inanimate object. For example, if you were to use bleach to clean your toilet, the bleach would be a disinfectant. The bleach would kill all the vegetative bacteria, but it would not kill the endospores. By vegetative, we mean the normal metabolically active bacteria. Antiseptics are chemical agents applied to living tissues. Antiseptics are usually less harsh and less irritating to the skin compared to disinfectants, but that is not always the case. For example, if someone were to use bleach to disinfect a wound on their cat, that bleach would be called an antiseptic. And although bleach is not often used, at least in the early days of necrotizing fasciitis, that would be the flesh-eating bacteria. One of the treatments for treating it, besides taking antibiotics, was to wrap the wound area in gauze that had been soaked in bleach. And I'm not sure of the concentration of the bleach, but my point is the bleach was used to treat the skin with necrotizing fasciitis. So bleach in this case was used as an antiseptic, not as a disinfectant. Any question about that? All right. To evaluate the effectiveness of chemical agents, the surface of a nutrient agar plate is inoculated with a particular bacterium. Paper discs, then saturated with different chemical agents, are then applied to the surface of the agar. The chemical agent will diffuse into the agar, establishing a concentration gradient around the disc. You then incubate the plate at 35 degrees Celsius and look at the bacterial growth pattern after the disc is incubated. If you find a zone of inhibition, an area of no bacterial growth around the disc, you can assume at the very least that the chemical is somewhat effective against that particular bacterium. Conversely, if the zone of inhibition if there's no zone of inhibition around the disc, then you can assume that the chemical is ineffective against that particular bacteria. Now, that does not mean that the bacteria is resistant or sensitive. This is just talking about the effectiveness. To determine whether the bacteria was sensitive to the antibiotic, you'd have to measure the diameter of the zone of inhibition and then look up that size diameter in the chart for that antibiotic and that bacteria. And if it would be the size of the zone of inhibition would be above a certain value, then it would be sensitive to that antibiotic. And then again, if the size of the zone of inhibition would be less than a certain value, then we would say that bacteria was resistant to that antibiotic. So do you see the difference here? One place we're talking about is the bacteria sensitive, and the other we're just saying that the antibiotic was at least a little bit effective against the growth of that bacteria. Any question on that? All right. We'll talk more about sensitivity and resistance later on in this lab. This table is showing you the different chemical agents and their preferred use and their general action. We're not going to talk about the general action, but ethanol and isopropanol, I'm sure you're all aware of those. We use this as an antiseptic against the skin, but it is a very weak antiseptic. And we really call them degerming agents, meaning when we apply alcohol to the side of your skin to give an injection, you're really only degerming, reducing the bacteria to low numbers so that when you give the puncture wound with the injection, that it will not cause at least a major infection in the patient. Aldehydes, formaldehyde, formalin, and glutaraldehyde are actually very good disinfectants. They're one of the few group of disinfectants that actually kill endospores. The other group of disinfectants that kill endospores are peroxygens, like hydrogen peroxide. Hydrogen peroxide is in many houses, and it is used as an antiseptic, but this agent, the peroxygens, actually do kill endospores. Halogens are also found in homes, most homes. Iodine, tincture of iodine is used as an antiseptic. Chlorine would be like chlorine bleach, a halogen that we use as a disinfectant. Heavy metals are agents that for a long time were no longer being used in the healthcare industry because they are fairly toxic. If you were to get mercury inside your body, consume mercury, that would be toxic. And actually, any heavy metal would be toxic if you were to get it inside your body. However, their use has come back in the last, I don't know, 5 or 10 years because of the development of drug resistance, that the bacteria have developed resistance to antibiotics. And so we're starting to use again in the health care industry the use of heavy metals. For example, they will often, not all the time, but often put a heavy metal in some gauze or something that's covering a wound to keep the wound from being infected. Heavy metals stopped being used only because they were toxic, and then there were other agents which were better, like antibiotics. But because of the development of drug resistance, we've come back to using heavy metals. I've already talked about peroxygens. Phenolics, that was the first agent used, phenol, by Joseph Lister when he was engaging in aseptic surgery. He would treat the patient and the instruments with phenol to sterilize the surgery. And phenol was actually a poor chemical to use because, first of all, it's irritating to the skin. Second of all, it has a disagreeable odor. And he didn't know that, but phenol, a long-term exposure to the skin, is actually a carcinogen. Now, if you're only exposed to it one time for one surgery, it'd probably be okay. But it's also corrosive to the metal surgical instruments. So like I said, phenol was not a good agent to use. Today, we use it mostly as a disinfectant when we're cleaning up, I don't know, spills or somebody throws up and you clean it with phenol. It can be used as an antiseptic at low concentrations. Surface active agents, quaternary ammonium compounds used as a disinfectant, and these are often used as soaps or something, detergents to wash things. Getting back to the size of the zone of inhibition, when you have a zone of inhibition around a disk, the size of the zone of inhibition is only partially dependent upon the sensitivity of the organism to the disinfectant or antiseptic or whatever is in the disk. Various other factors affect the size of the zone of inhibition, including the concentration of the chemical. If there's more chemicals in the disk, generally you'll get a larger size of the zone of inhibition. The molecular weight can affect the size of the zone of inhibition. Generally, the smaller the molecular weight, the greater it will diffuse through the agar, and then the larger the size of the zone of inhibition. The density of the bacteria inoculum can also affect the size of the zone of inhibition. If you have a very dense concentration of bacteria, you'll have a smaller size to the zone of inhibition. Any question about any of that? All right, when talking about the evaluation of antibiotic effectiveness, we can say an antibiotic is bactericidal if it kills the bacteria. On the other hand, if the bacteria only inhibits the bacteria's growth, meaning the chemical only inhibits the bacteria's growth, we call it bacteriostatic. And if you remove a bacteriostatic agent, the growth may continue, the bacteria growth may continue to grow. With a bacteriostatic antibiotic, we're relying on the host immune system to assist in the elimination of the infection. So you apply the bacteriostatic agent, the bacteria stop growing, that gives the host immune system the time it needs to eliminate the bacteria from the host. Any question about any of that? All right. The disk diffusion method, also called the Kirby-Bauer disk diffusion method, is the most common method used for testing antibiotic sensitivity. And it often helps physicians, for physicians to choose an antibiotic that may be used to treat a sick patient. This is particularly used if the first antibiotic the patient was given by the clinician did not work because the bacteria was resistant to the antibiotic. And so the clinician may take the bacteria and order a Kirby-Bauer test to be done, and then they'll grow up the bacteria on the surface of the agar plate, and it'll grow everywhere on the agar plate. Why? Let me blow this up. Why the plate is looking kind of whitish, except where there's a zone of inhibition around a disc. That's because the bacteria were plated everywhere. And then you put the disc on containing antibiotics, and then you incubate the plate, and then look for the zones of inhibition around the disc. And you can do this to determine which antibiotic would be the best one to use against this particular bacteria. Now, this one's showing several which the bacteria is sensitive to, but you could have a disc plate where the bacteria is resistant to many of the different bacteria, and then you're looking for one antibiotic that the bacteria would be sensitive to. And then you would give that antibiotic to this patient for the disease of the patient to be cured, the bacteria to be cured from the patient. So the Kirby-Bauer test is the most often used test to do this, and it's very helpful to the clinician. I haven't mentioned this to most of my other labs, so you guys are actually lucky. And that is the Kirby-Bauer test is actually very good at testing antibiotics, because when you give a patient antibiotics, the antibiotic has to diffuse out of the blood and into the tissue where the bacteria are. And that's very similar to the antibiotics diffusing through the agar on the Kirby-Bauer plate. Any question about any of that? All right. You then allow this plate to grow for about 18 hours at 35 degrees Celsius. And then you look at the size of the zone of inhibition. Where the antibiotic concentration is high enough, you'll see inhibition of bacterial growth. That may or may not kill the organism. It may only inhibit the growth. You then note that the size of the zone of inhibition is dependent on several factors. It is dependent on the diffusion rate of the antibiotic. An antibiotic which has a smaller molecular weight will diffuse more easily and further through the agar. So this large zone of inhibition may simply be because there's a smaller antibiotic here. And then this one, which is a small zone of inhibition, may be small only because the antibiotic is huge and has a very large molecular weight, and so it doesn't diffuse very fast or very rapidly or very far in the agar. The degree of sensitivity of the microorganism can also be a factor. For example, if these two antibiotics had the same molecular weight, and this one was more sensitive, we would see a larger zone of inhibition than the one where the bacteria were not as sensitive to the antibiotic. And then the growth rate of the bacterium can also affect the size of the zone of inhibition. I already mentioned that if you have a higher concentration of bacteria, then you would see a smaller zone of inhibition than if you had less bacteria. Like, for example, we didn't put the bacteria evenly on the plate, but more of it on this side of the plate compared to this side. Well, then you would have a smaller zone of inhibition on this side compared to this side. And that's assuming we're looking at only one antibiotic. The growth rate of the bacterium can also affect the size of the zone of inhibition. Let me see if I remember this now. If the bacteria grows more rapidly, generally speaking, the zone of inhibition will be smaller than if the bacteria were to grow slower. And that's not always the case, but that's often the case. So there are many factors that can come into play when performing the Kirby-Bayer distuffusion test. And to remove these factors, we highly standardize the variables that come into play when performing the Kirby-Bayer distuffusion test. So these are the standardized protocol for running the Kirby-Bayer procedure. First, you inoculate a nutrient broth using several bacteria colonies that have been grown on non-selective media. And then the colonies should be no more than 24 hours old, and you should grow the bacteria in the nutrient broth for no longer than 24 hours. The reason is we want quickly growing cells. As I mentioned, the growth rate of the bacteria will determine the size of the zone of inhibition. The slower the cells grow, let me think about that. Did I say that wrong before? Oh, never mind. Let's just move on. Anyways, 2, you adjust the broth turbidity so that there are 0.5 McFarland standard units per mil. That will be approximately 1 times 10 to the 5th bacteria cells per mil. McFarland unit is something they measure in a turbidity meter. You then inoculate Mueller-Hinton agar plates at room temperature, meaning all of this work is done at room temperature, and we only inoculate Mueller-Hinton agar. The different types of agar, meaning the different type of media, can affect the size of the zone of inhibition. Furthermore, the pH can affect the size of the zone of inhibition also, and so the agar plates are always between pH 7.2 and 7.4. If the agar is not that, you add an acid or a base to make the pH between pH 7.2 and 7.4. Furthermore, when you pour the plates, you pour it so that exactly the agar is of depth 4 millimeters. The thicker the agar, the slower the antibiotic will diffuse through the agar. And obviously, the thinner the agar, the more quickly the antibiotic will diffuse through the agar. So that would affect the size of the zone of inhibition. So we always use agar of 4 millimeters, and then we always use plates of 150 millimeters in diameter. You put the agar on the plates with a non-toxic swab using a spread plate technique. And you do this, put the agar, the bacteria everywhere, so the bacteria will grow in a lawn of bacteria, meaning the bacteria is growing everywhere. And then 5 minutes after placing the bacteria on the agar, you allow the plate to sit for 5 minutes so that it can absorb the liquid of the media. You then place the disc on the plate containing the antibiotic. The discs must be at least 24 millimeters apart from each other and no more than 12 discs put on a plate. And as I said, the plate will be 150 millimeters. So there it is right there. The antibiotic is added 5 minutes after putting the bacteria on the plate, but no later than 15 minutes after putting the bacteria on the plates. You then incubate the plate in a non-CO2 incubator for 16 to 18 hours at 35 degrees Celsius. And you put the plates in the incubator no longer than 15 minutes after you add the antibiotic disc. So that's the standard protocol. The purpose of this is so that two different people testing the same bacteria using the same antibiotic will get similar results from the Kirby-Bayer test. And that way, you can compare results from wherever the person is in the world, and assuming they're using the same antibiotic and they have the same bacteria strain. Any question about that? All right. After the bacteria are allowed to grow in the incubator, you then take a look at the plates and you measure the sizes of the zones of inhibition in millimeters. And then you get the diameter of that zone of inhibition and you compare that to the National Committee for Clinical Laboratory Studies, and that's usually abbreviated NCCLS. And they set the standards for interpreting the size of the zone of inhibition, whether the bacteria is considered to be sensitive to that antibiotic or resistant to that antibiotic or in between, and that's called intermediate to the antibiotic. For example, here we're looking at the bacteria Staphylococcus aureus. Growing here is white. There's the disc containing the antibiotic penicillin, that's penicillin G. And we have a zone of inhibition here, and that's about 20 millimeters. And you take a look at the NCCLS table of standards for Staphylococcus aureus with penicillin G. If the size of the zone of inhibition is 20 millimeters or less, we say that this bacteria, Staphylococcus aureus, is resistant to this antibiotic, penicillin G. On the other hand, if the size of the diameter of the zone of inhibition were to be between 21 and 28, we'd say that this bacteria is intermediate to this antibiotic. And if the size of the zone of inhibition were to be equal to 29 millimeters or greater than 29 millimeters, we say that Staphylococcus aureus is sensitive to this antibiotic, penicillin G. Any question about any of that? So that's how you determine if a particular strain of bacteria is sensitive to a particular antibiotic. You have to grow it up on the Kirby-Bayer test, measure it in millimeters, and then compare the size of this zone of inhibition to the NCCLS standards. And each bacteria strain will have a different NCCLS standard for each different antibiotic. So Staphylococcus aureus will have a different size for sensitivity for penicillin G than it will be for tetracycline. And then Staphylococcus epidermidis will have a different size for sensitivity for penicillin G from Staphylococcus aureus. Any question about any of that? All right. Know the terms of this lab shown here. You can skip the references. You're not going to be performing any of these activities. Everything will be done online, but you will be held responsible for knowing how to interpret the effectiveness of antibiotics using the Kirby-Bauer disc diffusion test. We have a little video clip for you to watch on preparing a spread plate. And here's the steps for preparing a spread plate. Let me go ahead and show you this. I gotta get my little tube substitute. Not really a test tube, but I don't have any test tubes. Not really a plate, but I don't have a plate. Not really a cotton swab. I could get a cotton swab if I were to go into my bathroom and dig it up from my, what do you call that? I've got one in the bathroom. And anyways, you take the cotton swab and you put it in the tube. Obviously, it's a sterile cotton swab, and you only have one bacteria growing in the tube. You put it in the broth to get the bacteria on the liquid. And then, I don't know if you can see this, you touch the swab on the edge of the tube to get the drops of media and bacteria so it doesn't drop out. And you actually squeeze it just a little bit against the side of the tube so the cotton swab is wet, but it's not soaking wet. Any question about that? You then take the cotton swab and your disc, you take off the lid to the disc, and then you take the cotton swab and you swab everywhere on the agar plate, covering the agar, the surface of the agar, with the bacteria that's in the liquid of the media. And then you rotate the swab a quarter of a turn. You rotate the plate a quarter of a turn. And then you re-swab the plate everywhere. And then when you're done with that, you rotate the swab one more time and you rotate the plate a quarter of a turn. And then you swab the plate everywhere. I once had a student who, when she was doing this, she didn't swab everywhere. She went doop, 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 doop. I'm trying to show it to you. Doop, 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 doop. Maybe she didn't even do it 3 times. I don't know. The point is she had vast areas of the plate that had no bacteria. And then she tried to measure the size of the zone of inhibition around the disc, and it was impossible to do because she didn't have bacteria growing everywhere on the plate. And she came and she showed me the plate, and she said, how can I measure the size of the diameter of the zone of inhibition? And I looked at the plate and I said, well, you didn't get the bacteria to grow everywhere. You were supposed to swab the plate everywhere, and you didn't. You've got vast holes of air on the plate that have no bacteria. So you cannot measure the size of the zone of inhibition. And I told her she'd need to redo the experiment, or she could use the data from her lab partner. Okay, so you do need to swab the plate everywhere, and you do it 3 times to make sure that you get bacteria everywhere on the plate. Then when you're all done with that, you take the swab and you move it around the edge of the plate. The reason is when you're swabbing like this, you might miss a little area near the edge. And so you swab the edge to get the bacteria to grow even on the edge. Oops, too far. You then take the plate, obviously you put the lid on, and then appropriately label it if it's not labeled, and then put it in the incubator upside, oh, wait a minute, no, you don't. first you have to put the bacteria on. So then you let the bacteria and the media sit for 5 minutes. And between 5 minutes and 15 minutes, you put the disc containing the antibiotics on the plate. And then no longer than 15 minutes later, you put the plate in the incubator to incubate for 16 to 18 hours at 35 degrees Celsius. Any question about that? All right, procedure 2 is going to look at the evaluation of antibiotic effectiveness. View the video clip for preparing a culture for Kirby-Bauer disc diffusion. And then we have another video for you to watch on interpretation of the results for the Kirby-Bauer disc diffusion method. And then we have a virtual lab on the Kirby-Bauer method. What you're going to want to do is hit start. You can read about the description and the steps of the Kirby-Bauer test, but let's just hit start. And what you're going to do is the first time you're going to be looking at E. coli grown on the plate and then tested with the Kirby-Bauer test for various antibiotics. S stands for streptomycin. The letters, E is probably erythromycin, but the letters here, yeah, it's erythromycin there. So the letter refers to the antibiotic, which is shown here. And then you take the ruler and you measure the size of the zone of inhibition. So right there, that's about 18 to 19 millimeters for the size of the zone of inhibition for streptomycin. And so that's greater than 15 or equal to 15. So we select that. If it's green, it means you selected the right answer. If you select the wrong answer, you'll see an X, a red X. Okay, so let's do it for tetracycline. I'm going to first select the wrong answer. And that's about 17 millimeters. So the wrong answer is here, an X, another wrong answer there. And so the correct answer is, like I said, 17. So it's green. And that's how you use this virtual whatever, whatever it's called, virtual test, the virtual thing. And to get the other plates, this is only the first plate containing E. coli, hit the menu and then restart. And then you'll see Pseudomonas aeruginosa. And you can do the same. Obviously for erythromycin, there is no zone of inhibition, so it's 0. And it's less than 13, so it's resistant. Oh, this shows you, by the way, up here. Let me blow this up. The size tells you what it is. In this column, the bacteria is resistant to this antibiotic. So that's Pseudomonas aeruginosa is resistant to the erythromycin. TM, I don't know what that would be, though, is the trouble, but we'll just select for TM. That might be greater than 17. Why am I not seeing TM now? I've got it too big. Oh, TM is way down here. So that is sensitive in this column. We have a third one. Let me shrink that again. Menu. And there's Staphylococcus aureus. And my guess is this might be MRSA, multi-drug resistant Staphylococcus aureus, because the only one I see that is has a zone of inhibition is vancomycin. And if you don't know, vancomycin is frequently used as the last possible antibiotic to use on MRSA, multi-drug resistant Staphylococcus aureus. that it's one antibiotic that tends to work on MRSA. This antibiotic is a harsh one to use, so it's rarely used, but it is used when a patient is resistant to other forms of antibiotic. And like I said, all of these other antibiotics were tested have no size to the size of inhibition. So this might be MRSA, which is Staphylococcus aureus. It's just multi-drug resistant Staphylococcus aureus. Anyways, those are the three bacteria we have. To get between them, you just hit the menu button, and this will start again with E. coli. Any question on using the virtual lab? If not, let's close that down. Like I said, the virtual lab, if you have a slow internet connection, it may take a while to load. Just give it the time it needs to load. All right, in step 2, you're going to be using standards required for Kirby-Bayer susceptibility test. An E. coli culture is prepared using the spread plate technique. Antibiotic discs are placed on the surface of the agar. The agar is then incubated at 35 degrees Celsius, and below are the results, along with the NCCLS zone standards used for interpreting the sensitivity or resistance of the bacteria using the sizes of the zones of inhibition. So right there, let me shrink this a little. So this is bacteria growing, E. coli. That's showing you the size of the zone of inhibition to the antibiotic ampicillin. And here's the antibiotic cephalosporin and gentamicin and tetracycline. We measure the size of the zone of inhibition using a caliper, shown here. You do not measure the size of the zone of inhibition from here to here, meaning that would be around 9 millimeters. And the reason is the 0 mark, the measurement, does not come to this position. The 0 mark is here. And to do the measurement, you measure from 0 here to 0 here. So the correct size for the zone of inhibition for ampicillin when testing against E. coli would be 15 millimeters. And that looks like it's a tad less than 15 millimeters, but we'll call it 15. And I've got that put in the table for you, the first one, ampicillin. The size of the zone of inhibition is 15 millimeters. And then do the interpretation. We will do that together. So we come up here and say ampicillin at 15 millimeters is I, and that means it's intermediate. And so you put in an I here. And then you measure the size of the zone of inhibition of cephalosporin, put in the measurement here, and then give the interpretation for E. coli here. Make sure you use this side of the table. Don't use that side of the table because that's not E. coli, that's Staphylococcus aureus. And I'm only showing you the data to E. coli. So that's how you answer this question. Number 3, make sure you put your questions on the worksheet. Let me go ahead and go to the worksheet. There we go. Only submit the worksheet, please. Because if everyone were to submit the lab modules, my website would soon become filled. And when it is filled, nobody will be able to submit an assignment. All right, 3, list 5 variables that must be standardized when performing an antibiotic susceptibility test using the Kirby-Bayer disc diffusion method. Question 4, the size of the zone of inhibition often varies for 2 different species of bacteria. when challenged with the same antibiotic? What is a possible explanation for these differences? 5. What would happen if we didn't use aseptic technique to put the antibiotic disc on the plate? Mention what will happen to our test results. 6. What would happen if we increase or decrease the concentration of the antibiotic in the disc? Be specific in your answer. And for full credit, you must answer both what would happen if you increase the concentration in the disc and what will happen if you decrease the concentration of the antibiotic in the disc. If you only answer for one, you'll only get partial credit. 7, antibiotics can be bactericidal. That means they kill the microbe, or they can be bacteriostatic. That means they only inhibit the growth of the microbe. They do not kill the microbe. If the antibiotic is bacteriostatic and then you remove the antibiotic, the bacteria may grow. On a Mueller-Hinton agar plate, I would think the bacteria would grow because the bacteriostatic just inhibits its growth. And assuming you're removing the antibiotic within a day or two, the bacteria should all be alive, or should be mostly alive. When observing a zone of inhibition around a disc, how would you determine whether the antibiotic causing that zone was bactericidal or bacteriostatic? I'm going to warn you that this is a thinking question. You cannot find the answer in the lab module. And this is a difficult question. Usually I have about 50% of the students getting the question wrong the first time. Fortunately, in the second grading of the lab, most of the students get this question right. So I'm just warning you, this is a difficult question. Occasionally, I've had terms where I don't get any student getting it right. And then on some terms, I get a lot of students getting it right on the first time. So think about it before you give your answer. And then when you give your answer, think about it and say, is that really right? Because like I said, this is a logical question. You got to think about this one. Just apply what you know about bacteria, growing bacteria on a agar plate. Apply what you know for antibiotics. Just apply it all together and you will be surprised once you figure out what the answer is, it actually makes sense and it's pretty easy. But like I said, it can be difficult. And I will give you a hint after the first grading if you get it wrong. Okay? 8, when performing antibiotic sensitivity testing, it is important that the test conditions are kept very standardized, meaning we use the same type of media, Mueller-Hinton plates. We always have the same agar depth, 4 millimeters. We always have the same age of the culture, etc. Why do we do that? 9, are there any other substances besides antibiotics we could evaluate using this method? And this is a little bit of a thinking question, but this one you can get an answer by looking it up in the lab module. So it's not that big of a thinking question. 10, does the presence of a zone of inhibition necessarily mean that the bacterium being tested is sensitive to the antibiotic? And explain your answer. 11, from the size of the zone of inhibition of chloramphenicol on E. coli in the virtual lab, is the bacteria sensitive to, intermediate to, or resistant to the antibiotic? And then for chloramphenicol on Pseudomonas aeruginosa, is the bacteria sensitive to, intermediate to, or resistant to that antibiotic? Any questions about any of these questions? If not, that's it for the lab. I will be here until 8:30 to help you with any questions you have, any discussion you want, anything you want. I will leave once the last student logs out though. So if you have any questions or comments, make sure you ask early on. Any questions? All right,
Thank you. Have a nice night.
you too.